Cool. Right. Go. Awesome. Hey guys, Dr. Nixon here. Hope you're doing well. Hey, welcome to our heart health webinar. So today we're going to walk through heart health, high blood pressure, high cholesterol for people who have had a heart attack, had a stroke, cerebral vascular disease, peripheral artery disease. We're going to talk through all of that, how to minimize your risk of heart attacks, how to minimize your risk of strokes, how to naturally lower high blood pressure and high cholesterol. So we have a lot to walk through, but it's going to be great. Hey, if you're in the office or you're a patient in our office here locally, and you watch this webinar, we're going to give you a special discount in the office on any supplements that we talk about or anything you want to get. The way you do it is you got to tell the front desk a couple things. One, you got to tell them I watched the webinar. And two, I love myself. That's the key. That's the key to getting your discount. I watched the webinar and I love myself, so give me a discount, and they'll do that. They'll do that for you. So, but we got a lot to walk through. I'm gonna walk through this. If you're brand new to us and don't know my face, my name is Dr. Nixon. I'm a holistic chiropractor here in Winston-Salem, and I really just have a passion for people experiencing their health potential. We really exist. My wife and I created this practice in this office really so people could experience hope, health, and wholeness. We really believe when you have your health, your life is different. Your life is just better. And this right here is a picture of me on the bottom. Aww. And that's my folks. My mom's from the Philippines. My dad is not. But this, my father really is a big part of why I do what I do. And just watching him go through a really pretty intense health struggles in his mid-40s. He had his first heart attack. Not shortly thereafter, had a second heart attack. They did a quadruple heart bypass. I'm so thankful for the medical system. They saved his life twice. They had him on a bunch of medications at one point, but then after that, at some point after a second heart attack, my dad thought, okay, I've got to make a change. And so he did. He changed the way he ate. He changed the way he moved. He started taking care of his nervous system. He lost over 100 pounds. He stopped smoking. He just made different lifestyle choices, and my father was able to reverse every single diagnosis. He got off all the medications they put him on, and ultimately I got my dad back. So listen, if you're watching this right now, maybe you've been through a heart attack. Maybe you've had a stroke. Maybe you've been diagnosed with high blood pressure or even high cholesterol. But you want to be healthy. You know there's a better way than just kind of managing your symptoms or covering them up with a medication. You know there's a better way to fix it. There is. It takes some effort. It takes some energy. You can make some changes, but it's doable. It's doable. And so I want to help you. I want to be your guide. I want to help show you some of the things that I've done with my patients. I'm not your medical doctor. I'm not going to put you on medications. I don't take you off medications. I'm not treating your diagnosis. I'm not treating your disease. So I want you to work with your healthcare professional, but I want to come alongside you and show you, hey, maybe there's a better way. Maybe there's another thing you can do. Because again, think about it. The research says it's a lifestyle disease. The majority of high blood pressures and heart attacks and high cholesterols and stroke, they're lifestyle diseases. So if you can lifestyle your way into it, surely you can lifestyle your way out of it. You just got to take different action steps. So let's hop into it. We're going to talk about high blood pressure first. When we talk about high blood pressure, typically we talk about high cholesterol. This is a big one for people, all right? So we're going to start by, we know the stats. We know that heart disease is the silent killer. We know it claims more lives than anything else in the United States. So where do we start? Cholesterol. You guys have seen this before. A lot of times we talk about HDLs and LDLs. HDLs, a lot of times we call the good cholesterol. LDLs we call the bad cholesterol, okay? In other words, here's how it really works. HDLs are going back to the liver to be recycled and utilized by the body. LDLs are coming from the liver as a healing mechanism for your body. So here's the example that I use, right? So if I'm running around and I fall on the ground and I scratch my elbow, my body lays down a scab, okay? It's a protective mechanism. Inside your artery, so in this picture right here, if that arterial wall gets nicked or scratched by something, the body lays down LDL cholesterol over it as patchwork. All right, so the question is, well, what would nick it? We're going to walk through this in a second. Lifestyle choices like food, specifically excess sugars. So it lays down a scratch, your body lays down plaque over it, but then you do that over and over, year after year after year. This is how we generate an inflammatory response that can cause a clogged artery. So let's jump into this. One of the things that research shows time and time again, one of the first things you want to do if you're trying to naturally lower blood pressure and naturally lower blood cholesterol levels, if you want to decrease heart disease risk, decrease stroke risk, you need to decrease your inflammation. Inflammation is red, hot, swollen, painful. It can come from a lot of ways, but specifically with the heart, it comes from foods first. So here's what you want to get rid of or eliminate: trans fats, bad fats, genetically modified oils like soybean oil and corn oil. Get rid of refined carbohydrates. That's a lot of like the fast foods. It's a lot of the conventional carbohydrates, conventional wheat, white breads. You want to get rid of that stuff. The last one there on the bottom, that's probably the biggest culprit: sugars. It's not the type of sugar, really it's the amount. It's the amount of sugars that we're consuming. So if you've maybe already been through a heart attack, I would really encourage you to eliminate sugars. If you're like myself and you're trying to live on the preventative side, I follow the 80-20 rule, 90-10 rule. 80-90% of the time we're eating really good. 10 to 20% of the time we're having a vacation meal. I like pizza. I went a whole year without it just to make sure I could do it, and I did it, and that feels good. But anyways, you want to just be careful, moderation. Right, but if you've been through a heart attack, been through a stroke, you don't want another one, I'd highly encourage you, maybe you just really try to eliminate sugars and processed grains from your diet the best you can. When it comes to bread, when it comes to grain, we know white bread is very inflammatory. Whole wheat bread can also be inflammatory. There are things you can eat. If you're following the 80-20 rule or the 90-10 rule, things like Ezekiel bread. Those are sprouted grains. Things like sourdough bread. A real sourdough is fermented for, I think it's at least 24 hours, and the fermentation eats the gluten. Gluten is the protein found in wheat that causes a lot of the inflammatory response. So fermenting it actually breaks that down, and you can consume that. It doesn't spike your blood sugar as much. It's a lot better for you. If you're going to consume grain, I would consume one of those two: sprouted grain or a real sourdough. Fun fact, if you're here locally, there's a place called Lavender and Honey that makes real sourdough bread. That is the sourdough bread that we eat in our house. Eliminating sugars, we talked about that. Incorporating healthy fats, I'll walk through that with you, what healthy fats to consume. So if you're looking for a diet plan or something to follow, this right here, this book, in this book you'll find the advanced plan. The advanced plan is what you want to use if you're trying to get off blood pressure medications, you're trying to naturally lower blood pressure, trying to naturally lower high cholesterol levels. You want to follow the advanced plan. This book's in our office. You can also get it online at twincityhealth.com. Go there to get this. It's super helpful. What do you want to add in? Start with bone broth. Bone broth is really good for your blood vessels. Has glucosamine, amino acids, lysine, and glycine. The other thing you want to add in is healthy fats. Healthy fats come from nuts and seeds, walnuts, almonds, chia seeds, flax seeds. All those are really good and loaded with healthy omegas. Healthy omegas, you can add those into your diet. Here's some more things. Different leafy green vegetables, things like broccoli and bok choy, they are loaded with vitamin K. Vitamin K2 is very good for your arterial walls in your heart. Vitamin K. Beets. Let's stop here for a second. Beets are best. Here's why. Beets act as a vasodilator. They increase your oxygen content in your bloodstream. So if you have congestive heart failure, difficulty breathing because your heart isn't as efficient as it used to be, high blood pressure, adding beets into your diet can increase oxygen and ultimately help you. So I would encourage you to do that. Trader Joe's has beet chips. You can get them. They're delicious. They're easy to eat. There's only one ingredient: beets. We talked about adding in different nuts and seeds. You can also add in some antioxidant-rich fruits, things like blueberries and blackberries, things like pineapple. Pineapple has bromelain in it, and also really good for your arterial walls. Another one, herbs. There's two of them, turmeric and ginger. Turmeric and ginger, they're actually both roots, but they're both anti-inflammatory. Remember, we're trying to decrease the amount of inflammation in your body. So you add those into your diet. I always try and tell people food first. I'd rather you consume food first than taking a bunch of supplements. Real food is better. Here's another couple ones. Cayenne pepper. Cayenne pepper is a vasodilator. What that means is it opens up your arterial walls. It'll increase the rate at which blood can flow through your vessels, increasing oxygen to your brain, increasing your heart capacity and function. So if you're into spice, go for that. Garlic's the next one. Garlic's antibacterial, it's antiviral, it's antifungal, it's great for your immune system, but it has something in it, a compound called acillin. Acillin's known in research to actually lower blood pressure, so add that into your diet as well. Cool, supplements. So here's where to start. There's really two of them that I encourage you to start with. If you struggle with high cholesterol, high blood pressure, I would definitely start here. Number one, curcumin. Curcumin is the active ingredient in turmeric. It's one of the most potent anti-inflammatories. It's the most researched herb. There's even good research on minimizing effects of depression, increasing mood, increasing cognitive function, increasing your metabolism. But right now we're talking about how to help your heart and how to lower cholesterol. So add curcumin into your diet. And the other one's a fish oil. More and more, the medical research and doctors are talking about fish oil. It's good for your brain, it's good for your heart, it's good for your cardiovascular system, and it's super, super valuable and important. So I would take fish oil. Personally, I take mine at night. It prevents the fish burps, and it's also good for your hormones when you consume fish oil at night. So do it that way. Here's the other one. Pay attention to this. This is super important. If you are on a statin drug, pay attention. Okay, if you're on Crestor or Lipitor, any other versions, the generic versions, any type of statin drug, you need to be taking CoQ10. Here's why. What we know is that cholesterol-lowering medications will lower your cholesterol, but they come along with side effects. They turn off production of protein, and they turn off your production of CoQ10. CoQ10 is a heart antioxidant. It protects your heart from a heart attack. So if you're on a statin drug, I encourage you and really highly recommend you need to be on a CoQ10. I haven't had a heart attack, but I take CoQ10 as a preventative. You can find that, the one that I take, you can find in our office. You can also find it online, twincityhealth.com. Another quick thing while we're talking about cholesterol, one of the other things you can use instead of a statin drug, or even with a statin drug, you can take red yeast rice. Red yeast rice, they use it in Chinese medicine. They've been using it for years. But in ancient Chinese medicine, it is the natural statin drug. So if you're trying to lower your cholesterol values, specifically your LDLs, take red yeast rice. That will naturally lower it. Here's one of the other things. For high blood pressure, the nerve that controls the barometer for your blood pressure is called the vagus nerve. Not Las Vegas, V-A-G-U-S. It's a cranial nerve, comes out of the top of your brainstem here. It controls the fight or flight mode and the rest and digest mode. So if you're a patient and when it comes to our office with high blood pressure, this is one of the areas we'll look. Not because we're trying to treat their high blood pressure, but because we're trying to normalize or regulate the function of their nervous system. So this is how chiropractic helps with regulating blood pressure. It's why there's research. Recently, one came out where it talked about chiropractic adjustments. One adjustment was better than both two blood pressure medications combined. Right? But it comes down to the function of the nervous system that controls the heart. So, hey, last couple things. I'm excited to teach you guys this. I think this is super practical and a really easy way that you can really be in control of your health and even on the preventative side. So if you've had one heart attack, you don't want to have another. If you've had one stroke, you don't want to have another. If you haven't had any, but it runs in your family, you want to be preventative. There's a couple blood tests that the medical system is running a little bit more and more, but it's a blood test that you can ask your doctor to do and can really give us insight into how to take care of your body. So this test right here is called LPA. Stands for lipoprotein A. It is in fact the prime indicator on blood testing for your heart attack risk. The problem is they don't usually run it until after you've had a heart attack. But what if you ran it before? It would actually help us predict, or at least to be aware of, am I at risk for a heart attack? And if I am, then I can change something. So next time you go to your doctor, when he's running your normal cholesterol values, ask him to test LPA, lipoprotein A. So what we know is if your levels are too high, you're at a 50% greater risk of a heart attack. Man, prevention's powerful. Prevention's powerful. So get that number tested. Here's a couple other ones I want you guys to ask your doctor for. CRP stands for C-reactive protein. It's an inflammatory marker for your cardiovascular system. So I'm talking about reducing inflammation, and you're wondering, like, am I inflamed? This number will tell you. This number will tell you. You want your number to be close to 0. My last one was a 0.4. I've seen numbers, high numbers like 10. I've seen numbers in the 80s, and it's really scary. There's a lot of inflammation in the body at that point. So get your number tested. This is a way more common one. Sometimes you got to ask your doctor to do it, but they'll do it. Lipoprotein A, add that in with your normal cholesterol panel, and then homocysteine. This is for peripheral artery disease, arrhythmias, people who have had strokes. You want to get this number tested routinely. It will tell you the inflammatory response inside your blood vessels. Inside your blood vessels. And again, if that number is high, what do? Change it. We eliminate sugar. We're minimizing grains. We're taking things like CoQ10. Get a good fish oil. Curcumin. Put turmeric in your diet. Add garlic. Add ginger. Add cayenne pepper. Exercise. Move. Minimize stress. Take care of your nervous system. These are all lifestyle changes that we can add in to our body. So I hope this was helpful and encouraging. Remember, health is a journey. It's definitely a process, but you're worth it. That's my little guy. That's my best buddy. My wife is my best friend, and he's my best buddy, and I love these guys so much. And remember this, when health gets hard, if lifestyle changes get tough, just remember it's about you, but it's also about the people around you, the people who love you a lot, the people who care about you. For me, like I don't want to put my family through just what I experienced when my dad had his heart attacks. I don't want to have to do that to myself or my family, and so I take the side of I want to prevent it. Prevention's powerful. But be encouraged. You're worth it. You're worth the steps and the action steps it takes to experience health. We're here for you. I want to be your encourager. I want to be your guide. I want to show you what to do. I can't do it for you, but I do want to be here to encourage you. My team does as well. So if you have any questions, comments, things you need help with, ask us. If you have blood work after you get those ran by your doctor, we'd love to look at them with you. I'm not your doctor. I'm not your primary doctor. I'm not going to run the blood tests for you. But I'm not going to put you on medications. I'm not going to take you off medications. So you got to work with your provider. But I want to help be a guide and help encourage you along the way through the process. So if you need anything ever at all, we're here for you. My personal email address is dr.nixon@twincityhealth.com. Email me there with anything you need, and we want to be there to support you guys. We love you. We believe in you. We know health is a journey. It's a process, but you're worth it. You're worth it. Hey, if you want that discount, any of the things we talked about, talk to my front desk. You got to let them know I watched the webinar. Good job. And number 2, I love myself. I love myself. So bless you guys. Love you all so much, and we'll see you next time.